Familial Mediterranean fever, or FMF, is a rare disease that primarily affects people of Mediterranean descent. It is an inherited condition, meaning it is passed down through families. The disease is characterized by recurrent episodes of fever and inflammation in the abdomen, chest, or joints. These episodes can be quite painful and can last from a few hours to several days. The inflammation caused by FMF is due to a defect in the body's inflammatory response. This defect leads to an overreaction of the immune system, causing the painful symptoms associated with the disease. The inflammation can affect various parts of the body, including the lining of the abdomen, the lining around the lungs, and the joints. This inflammation leads to pain and other problems such as swelling and redness in the affected areas. Patients often experience severe abdominal pain, chest pain, and joint pain during an attack. These symptoms can be debilitating and significantly impact the quality of life of those affected. FMF is passed down through families, and it is caused by mutations in the MEFB gene. This gene provides instructions for making a protein called pyrin, which is involved in controlling inflammation. When there are mutations in this gene, the protein does not function properly, leading to the uncontrolled inflammation seen in FMF. People with FMF have attacks of inflammation that can occur without warning. These attacks are often triggered by factors such as stress, infection, or physical exertion. During an attack, patients may experience fever, severe pain, and swelling in the affected areas. These attacks can be extremely painful and can interfere with daily activities. Patients may need to rest and take medication to manage the pain and inflammation. It is important for patients to work closely with their healthcare providers to develop a treatment plan that works for them. The attacks can last for a few days, and during this time, patients may need to take time off work or school to rest and recover. It is important for patients to listen to their bodies and take the necessary steps to manage their symptoms. Then they go away on their own, and patients can return to their normal activities. However, it is important to note that FMF is a chronic condition, and patients may continue to experience attacks throughout their lives. With proper management, patients can reduce the frequency and severity of attacks and improve their quality of life. FMF is more common in people from certain areas, particularly those of Mediterranean descent. This includes people from countries such as Turkey, Armenia, and Arab countries. However, FMF can also affect people from other regions and ethnic backgrounds. These include the Mediterranean and the Middle East, where the disease is more prevalent. It is important for people in these regions to be aware of the symptoms of FMF and seek medical attention if they experience recurrent episodes of fever and inflammation. It is important to remember that anyone can get FMF, regardless of their ethnic background. Early diagnosis and treatment are key to managing the disease and improving the quality of life for those affected. If you or a loved one are experiencing symptoms of FMF, speak to a healthcare provider for further evaluation and management.
FMF attacks can cause a variety of symptoms. These symptoms can range from mild to severe. The most common symptom is abdominal pain. Chest pain is another frequent symptom. This pain may be worse when breathing. Joint pain is also common. The joints may be swollen and tender. Other symptoms include fever, skin rashes, headaches, and muscle aches. Men may experience swelling in the scrotum.
Many things can trigger an FMF attack. Stress is a very common trigger. This can be emotional stress or physical stress. For women, menstruation can be a trigger. Changes in weather can also cause attacks. Cold exposure is a common culprit. Infections can trigger FMF. Some foods may also be triggers. It is important to identify your personal triggers.
Section 6. Colchicine, the cornerstone of FMF treatment. Colchicine is the main medication used to treat FMF. Colchicine is an anti-inflammatory drug. It helps reduce inflammation in the body. Colchicine can prevent FMF attacks. It can also reduce the severity of attacks. Colchicine is taken daily. It is important to take colchicine exactly as prescribed. Your doctor will determine the right dosage for you.
Section 7. Living with FMF, long-term management and lifestyle adaptations. Living with FMF requires ongoing management. This includes taking medication as prescribed. It also involves making lifestyle changes. Avoiding triggers is crucial. This may involve managing stress. It may also involve avoiding certain foods. Regular exercise can be helpful. It is important to get enough sleep. Eating a healthy diet is also important.
Section 8. Untreated FMF, risks and complications. Familial Mediterranean fever, or FMF, is a hereditary inflammatory disorder that can have severe consequences if not managed properly. Understanding the risks and complications associated with untreated FMF is crucial for patients and healthcare providers alike. If left untreated, FMF can lead to serious complications. The recurrent fevers and inflammation can cause significant distress and long-term damage to various organs in the body. Patients may experience frequent episodes of pain and discomfort which can severely impact their quality of life. One serious complication is amyloidosis. This condition occurs when an abnormal protein called amyloid builds up in the organs and tissues, disrupting their normal function. Amyloidosis can affect multiple organs including the kidneys, liver, heart, and nervous system, leading to a range of health issues. Amyloidosis is a condition where protein builds up in the organs. This buildup can cause the organs to become enlarged and less efficient, ultimately leading to organ failure if not addressed promptly. Early detection and treatment are essential to prevent irreversible damage. This can cause organ damage. The kidneys are particularly vulnerable, and amyloidosis can lead to chronic kidney disease or even kidney failure. Patients with kidney involvement may require dialysis or a kidney transplant if the damage is severe. FMF can also lead to kidney problems. In addition to amyloidosis, the inflammation associated with FMF can directly affect the kidneys, causing conditions such as glomerulonephritis. This can result in proteinuria, hematuria, and reduced kidney function over time. Infertility is another potential complication. Chronic inflammation and frequent episodes of fever can affect reproductive health in both men and women. Women with FMF may experience irregular menstrual cycles, while men may have reduced sperm quality and count. Inflammation of the heart or the lining around the heart can occur. This condition, known as pericarditis, can cause chest pain, shortness of breath, and other cardiovascular symptoms. If left untreated, it can lead to more severe heart conditions, including heart failure. It is important to seek treatment for FMF. Early and consistent treatment can help manage symptoms, reduce the frequency of attacks, and prevent complications. Medications such as colchicine are commonly used to control inflammation and prevent amyloid buildup. Treatment can help prevent these complications. By adhering to a prescribed treatment plan and regularly consulting with healthcare providers, patients with FMF can lead healthier, more fulfilling lives. Early intervention is key to minimizing the risks and ensuring better long-term outcomes. Section 9. Taking charge of your health, a hopeful outlook for FMF patients. Living with familial Mediterranean fever, or FMF, can be challenging, but there is a hopeful outlook for those who take charge of their health. FMF is a lifelong condition. It is characterized by recurrent episodes of fever and inflammation, often affecting the abdomen, chest, or joints. These episodes can be painful and disruptive, but understanding the condition is the first step towards managing it effectively. However, with proper management, people with FMF can live full and active lives. Regular exercise, a balanced diet, and maintaining a healthy lifestyle are crucial. Engaging in physical activities like jogging, playing sports, or even enjoying a picnic with family can significantly improve overall well-being. Early diagnosis and treatment are essential. Identifying FMF early allows for timely intervention, which can help manage symptoms more effectively. Regular checkups and medical tests play a vital role in monitoring the condition and adjusting treatment plans as needed. This can help prevent complications. By adhering to prescribed treatments and following medical advice, patients can reduce the risk of severe complications such as amyloidosis, which can affect the kidneys and other organs. It can also improve quality of life. Effective management of FMF not only alleviates symptoms, but also enhances the overall quality of life. Patients can enjoy social activities, spend quality time with loved ones, and pursue their passions without being hindered by their condition. If you have FMF, work closely with your healthcare provider. Open communication with your medical team is crucial. They can provide personalized advice, adjust treatments, and offer support tailored to your specific needs. They can help you manage your condition. Regular monitoring and adherence to treatment plans are key to keeping FMF under control. Your healthcare provider can guide you through lifestyle changes, medication adjustments, and other strategies to manage your symptoms effectively. There is hope for a brighter future with FMF. With the right approach, support, and determination, individuals with FMF can lead fulfilling lives. Embrace the journey, stay informed, and remain optimistic about the future.